Hello and welcome back to my channel. Today we are going to talk about what Amberlynn Reid doesn't understand about weight loss surgery. Hi, my name is Kat. I have a Bachelor's of Science in Nutrition and I'm working on my Master's in Nutrition Diagnostics while also doing my internship so I can become a registered dietitian. I am not one yet, but I am working on it. And today I want to talk about some things that Amberlynn Reid didn't know going into her looking into getting weight loss surgery. And when I was watching that video, I realized that this is not common knowledge for people who don't work in the medical field and things like that. So I want to talk about some of the reasons why she was, rejected for weight loss surgery, at least at the time that she was seeking it, and why that's actually a really good thing, and some things that you should consider when telling someone to get weight loss surgery, considering it yourself, if a family member is considering it, any of those things. So if you don't know, Amberlynn Reid is a morbidly obese woman who is here on YouTube. She's had a channel for I think like 8 years now. She's been on here for quite some time. She began her channel intending for it to be a weight loss channel, but unfortunately it has gone the other way and she has actually gained a significant amount of weight while she has been active on YouTube. So recently she took about a month off of YouTube, and when she came back she made a video talking about her weight, and she said that she had actually sought out weight loss surgery while she was on that break from YouTube. And she was unable to get it, and she talked about how there was a psychological screen and how she would need to be going and seeing a counselor for quite a long time and resolve some of the issues that she has with binge eating. In her case specifically, she has an issue with binge eating that she's been very open about before she can get a bariatric or weight loss surgery. So that is, my first point of one thing that people don't know about weight loss surgery is that you can't just go get it. There's actually quite a long process to being approved for bariatric surgery, and in fact it can take a full calendar year, sometimes more, sometimes less, for someone to be able to actually get bariatric surgery from the time they start pursuing it to when they actually get it done. And there's very good reason for this. Reasons being, one, psychological issues like Amberlynn Reid was talking about. If you have an eating disorder, especially something like a binge eating disorder, that isn't going to go away because you had an operation. That's not going to cure it, that's not going to fix it. And now that you've had this major abdominal surgery that has changed the structure of your stomach and possibly your intestines, that can actually become quite a bit more dangerous. Here's why. So the most common types of bariatric surgery, at least currently, are a Roux-en-Y gastric bypass. And what that does is so you've got your stomach and then you've got your intestines, right? So a Roux-en-Y gastric bypass is not only a restrictive operation where it reduces the size of your stomach to restrict the volume of food you can have. So not only does it do that, where it takes part of your stomach, disconnects it from that first part of your stomach where the food is actually going to fall into, makes that pouch very, very small, but it also attaches that small pouch lower down in your intestine than where your stomach would originally empty out. So now not only can you not fit as much volume of food, you're also bypassing part of the intestine. So not only is it restrictive, it is also malabsorptive. You're passing part of the intestine, it's not absorbing anything because it's not coming into contact with food anymore. So that is the first type that is very popular. The second type that is very popular, and I believe is gaining a little bit more popularity over Roux-en-Y's at this point in time, is a laparoscopic vertical sleeve gastrectomy. And that is just a fancy way of saying they take off most of your stomach, and this one is purely restrictive. It doesn't do anything with the intestines, just the stomach. So it takes it from normal stomach size to, I know some surgeons who have said, well, I don't know them personally, I have heard of some surgeons who say they make the stomach pouch about the size of a pencil. So very small amount of volume of food can fit in that much reduced sleeve of your stomach after that surgery. So those are the two most popular types. Now both of those are, like I said, restrictive. So if someone who has just had a restrictive surgery where their stomach has been reduced and there are now staples or sutures in their stomach goes and has a binge, that goes from being a very unhealthy pattern that can do harm over time to something that could be life-threatening right now. Because if they do go and have a binge, it is possible that they could rip sutures or pop a staple, things like that. And if that happens, then they can be spilling gastric contents into their abdominal cavity. That's an ER visit you do not want to have. That can also lead to an infection called peritonitis, which is very painful and you really don't want to have to deal with. So it can actually make binge eating disorders a lot more dangerous when you have that fresh surgery in your stomach. which is the principal reason that Amberlynn was unable to get hers at this time, right? That psychological screening showed that, okay, yes, she has some binge eating issues, so she would need to be seeing a counselor and working through that and resolving that before she would be able to be approved for this surgery. One other thing that people don't realize is you can't just go in and say, hey, I'm overweight, I just haven't been able to lose weight, let's just do this surgery. That's not quite how it goes. Most places are going to require you to do about 6 months as an average of medically supervised attempts at weight loss before they will go to surgery. So while you may not have surgical intervention, you will be seeing a dietitian, seeing a counselor, psychologist, someone like that, and trying to lose weight like that with other like lifestyle interventions with your dietitian and with your counselor for several months before they say, okay, yeah, that's not working. We need to consider surgery again more seriously now that you've tried this with supervision. The other interesting thing is that there's almost a weird gray area of BMI where it's harder to get bariatric surgery. So the standards for being considered for bariatric surgery are BMI of over 40, which Amberlynn does meet. So over 40 at all, you can start being considered for bariatric surgery, do those months of attempting weight loss under medical supervision, and if that's not successful, or if you don't make a whole lot of progress, then they may still consider you for bariatric surgery and you can get the surgery. Or, second criteria is a BMI of 35 with comorbidities. So comorbidities would be something like type 2 diabetes, hypertension, sleep apnea, things like that will also increase your risk of dying if you don't lose weight. So there are other complications that are related to the obesity that is present in someone whose BMI is over 35. So Amberlynn does meet those standards. I don't know if she has comorbidities. I don't really follow her. Anyways, none of my business if she does or doesn't. Either way, she meets the BMI criteria of being over 40 BMI. But weirdly, there are some surgeons who won't operate on people who have a BMI over 40 and so will require them to lose weight until they hit a BMI of 40 and then they can get the surgery to continue losing weight, because it can also be very dangerous to operate on someone who is severely obese, morbidly obese. They don't always heal as well, and sometimes it can be even with laparoscopic procedures, right, where they just make a small incision and they have like the camera and they do most things internally. That can be harder to do on someone who is very morbidly obese, just depending on how much visceral fat there is and everything else that's going on. And, you know, it depends on the surgeon too. Like, a lot of people, because of my 600-pound life and shows like that, think that bariatric surgery might be easier to get than it is. And of course, Dr. Now, the surgeon who's on my 600-pound life, very much specializes in bariatric surgery. So he is more comfortable operating on people with a BMI over 40 than maybe some other surgeons might be. And even then, there are still risks. If they don't heal very well, they might have delayed healing, and the longer you have wounds open like that in your abdomen, even if it is a smaller one, the longer it's there, the higher chance of it getting infected, things like that. And especially if you have someone who is a type 2 diabetic who has higher blood sugars anyway, bacteria love the sugar, they need it to live, so that can also be a big problem if that is one of the comorbidities of someone who is seeking bariatric surgery. Another thing that people don't always consider is that bariatric surgery is not an easy out, it's not an easy fix, it's not easy by any means. Not only can it be very hard on your body with a surgery that alters the way your digestive tract works, it can also be mentally one of the hardest things that people have ever done. In fact, that has been said many a time on online support groups for people who've undergone bariatric surgery, that it is the most difficult thing that they've ever done in their life in some cases. And it can also send people to a pretty dark place. It can be very hard to have your relationship with food permanently altered very suddenly, because again, once you have that surgery, there's not really any going back. There is a very strict post-operative diet. In fact, the first 2 or 3 days you are on clear liquids only. So that's things like broth, juice, Jello. It's very strict. And even past those first 3 days when it's just clear liquids, it's very strict beyond that as well. You're on a liquid diet for quite some time. The goal is usually by about the month mark to have more solid foods in your diet. And even then you have to very thoroughly chew anything that you're swallowing, because again, sutures, staples, whatever it is that they used to close the stomach up after they resected part of it, whatever is there You really don't want to be agitating it with something that is, crunchy or sharp or very fibrous or anything like that. Other weird thing, it's not weird, but other thing people may not think about is that people who've had bariatric surgery can actually be at a risk for protein deficiency, which is not very common here in the US. Most people here in the US meet their protein needs no problem, and in fact double or even triple protein requirements in their daily diet. But with bariatric surgery, again, very restrictive. That stomach has been quite reduced, so you can only handle about a quarter cup of food at a time. Yes, quarter cup of food at a time. So of course they have to eat several times a day to be able to have even like 800 calories spread over a quarter cup of food. You still have to be eating quite a bit to even hit that small number. And the majority of that food is going to have to be protein, because of course you just had surgery, so you need to be healing from that. Anytime you're losing weight with surgery or without, you want to keep your protein a little bit higher to preserve as much muscle mass and lean mass as possible while you're losing weight. And someone who's having bariatric surgery is larger in general, and their protein needs would be higher anyway. So when they are so severely restricted on the volume of food that they can have, protein deficiency becomes a very real possibility for them. And one of the other things that can happen pretty commonly with bariatric surgery that kind of goes with that protein deficiency is you might lose a lot of hair. You might start having very weak, thin, brittle, peely nails, might have very dry skin, things like that. Those are things to watch out for. Another thing that people really need to watch out for, especially if they've had a malabsorptive procedure like the Roux-en-Y, where it bypasses part of your intestines, that first part of your intestines, the duodenum, that's bypassed in that kind of surgery, does a lot of absorbing of different vitamins that, of course, we need. So one of the things that also has to be done on a post-bariatric surgery diet is supplementation of different vitamins and minerals. And in fact, it's usually recommended that people who've had a malabsorptive procedure take liquid vitamins, because those are going to be the most easily absorbed. And one thing that is kind of scary is that if you are not good about taking these liquid vitamins, or vitamins in general, depending on what your surgeon recommends for you, if you're not good about taking those vitamins, you can actually end up with permanent brain damage if you are not taking your B vitamins in that liquid form so they can actually be absorbed, because that is one of the side effects of long-term and severe B vitamin deficiencies like thiamine, B12, things like that. If you're not getting them, you can start having neurological effects, and those aren't reversible. Once those are there, those are there. So if you're not good about taking vitamins every day, or you just don't want to, or you think you don't really need to, that can be a big problem. So that's part of that psychological assessment, is seeing if the person who is interested in getting surgery would be willing, able, capable, all of those things, to take those vitamins and do that diet after the surgery. And that's one other reason why it's really not a good idea for Amberlynn Reid specifically to be having this kind of surgery right now. She has, again, been very open with her binge eating disorder and things like that. So trying to put her on a very restrictive, not only in volume, but also in what can go into that volume, again, they're on a liquid diet for quite a while, probably would not be successful for her at this point in her life. So even if she were trying to keep the volume down, if she was like, I really just want a piece of orange chicken, it's protein, how can it be that bad? I really just want this piece of orange chicken, and she doesn't chew it well enough, she could eat it, have it, and it could, again, rip open a staple or something like that. So there is definitely a reason why those psychological screens are in place, because they definitely play quite a big role into post-operative success. One of the other reasons that people say it's the hardest thing that they have ever done is because so much of our social life, at least here in the US, revolves around food. Of course, when people are coming over, and I mean, it's Thanksgiving today, literally today, as I'm filming this, it is Thanksgiving, which of course is a very food-oriented holiday, just like most of ours are. And even beyond our holidays, most of our social gatherings are food-related. If you're going to go catch up with a friend, you go to get coffee, you go to get a drink, you go out to lunch together. Even if it's not catching up with an old friend, if you want to go hang out with your friends, you usually go get dinner, or go grab a drink, or go do something like that, or come over for dinner, come watch this show with us, and we'll all bring something to share. We definitely have a very food-oriented social life here in the US, and I think most places are like that, but I know for sure here in the US our social activities typically involve some kind of food, and that can be really, really hard when you have just had surgery and you're sitting there with your little protein shake while everyone else is having what used to be your favorite food that you can't have right now and possibly ever again. That can be very difficult. And eating is something we do 3 times a day, so it changes a very fundamental activity to our everyday lives. And that can be much more life-altering than some people think it's going to be or even realize. So that is another reason why going to see a therapist, counselor, someone to help you work through those issues is very important. This surgery changes more than just your body. So I hope that maybe enlightened you to some of the factors that go into bariatric or weight loss surgery and why it's not a good idea for everyone and why it's not just an easy fix. For more content, hit that subscribe button. And if you want to see a bunch of gym selfies and food that I make, you can go and follow me on Instagram. Thank you so much for watching. I hope you are having a wonderful holiday season, whatever you choose to celebrate or not celebrate. I hope you're having a great winter. Thank you so much for watching, and I will see you next time.